All right, so we're diving deep today into lymphedema,
Absolutely.
which, as you know, is a really important topic for surgical residents and something that really often comes up on board exams like the FRCS plastic surgery.
Yeah, absolutely. A must know for your exams and also just for, day-to-day practice later on.
Right,
in
exactly.
life.
So we're going to try and break down everything you need to know as simply as possible, really focusing on those key
The
facts.
essentials, yeah.
Exactly.
That you need to have down cold.
So let's start with the basics.
Okay.
What exactly are we talking about when we say lymphedema?
So in the simplest terms, lymphedema is basically a buildup of fluid in the tissues.
Right.
And it's not just any fluid. It's this protein-rich fluid
Okay.
that accumulates because the lymphatic system, the system that's supposed to drain it, isn't working properly.
So it's like a drainage problem.
Exactly, a drainage problem.
And I imagine this, fluid buildup can't be good for the tissues.
No, it's not good at all.
All right.
Initially, you might see just some soft swelling, that pitting edema where you press on it and it leaves a dent.
Yeah.
But as it progresses, it can become harder non-pitting.
Oh, wow.
The tissues can get really enlarged and fibrotic.
Okay.
And eventually, you can even get blockages in the lymphatic vessels themselves.
So it can actually worsen over time and get more severe.
Absolutely. It's a progressive condition.
So then tell me a little bit more about this lymphatic system that we're talking about.
Sure. So the lymphatic system is kind of like this hidden network of vessels and nodes
Okay.
that runs throughout the body.
Okay.
And its main job is to, clear out waste products from the tissues.
Right.
Things like proteins, lipids, stuff that shouldn't be hanging around in the interstitial space.
Okay.
And it transports all that stuff back into the bloodstream.
So it's like a cleaning crew for the body.
Yeah, you can think of it that way.
Okay, cool.
It's essential for keeping everything balanced.
And you mentioned that the system relies on pressure gradients, right?
Yeah. Yes, exactly. So the lymphatic vessels have these little valves. Okay. And the fluid, the lymph, is propelled along by differences in pressure.
Got it.
It's a bit like, squeezing a tube of toothpaste.
Oh, okay, I see.
You apply pressure at one end and the toothpaste moves along.
Okay, so it's like a one-way system.
Right, exactly.
And we have two separate lymphatic systems, right?
That's right. There's the superficial system, which is closer to the skin.
Okay.
And then there's the deep system, which runs deeper in the body.
Okay.
Both are important.
And each of those systems is made up of these lymphangions, right?
Yes. A lymphangin is the basic functional unit of the lymphatic vessel.
Okay.
It's a segment of the vessel that has muscle in its wall,
Okay.
and it contracts to help pump the lymph fluid along.
So like a little mini pump.
Exactly.
And you also mentioned that there's a difference between lymphatic vessels and blood vessels.
Yeah, so unlike blood vessels, lymphatic vessels have these little gaps between the cells and their walls.
Okay.
And these gaps allow larger molecules to pass through.
I see.
Things like proteins and fats, which are too big to get through the walls of blood vessels.
And these are the molecules that need to be cleared out.
Right. They need a way to get into the lymphatic system.
Right.
And these gaps provide that pathway.
And that's where those pressure gradients come in.
Exactly.
So it's all very cleverly designed.
It is a very efficient system when it's working properly.
Right. And another important point is that muscle tissue itself doesn't actually have any lymphatic vessels.
Yeah, that's right. It's kind of counterintuitive.
Huh. Okay.
But the lymphatic vessels run in the connective tissue surrounding the muscles,
Interesting.
not within the muscle fibers themselves.
So how does the lymph fluid get out of the muscles then?
So that's where muscle contraction comes in.
Okay.
Every time a muscle contracts, it squeezes the surrounding tissues,
Right.
and that helps push the lymph fluid along.
So it's like a natural pump?
Exactly. Exercise is really important for maintaining good lymphatic flow.
Wow. So even just walking around is helping to move that lymph fluid.
Absolutely every movement helps.
Okay, that's really interesting.
And to give you an idea of just how much work the lymphatic system does,
Right.
it actually processes a huge amount of albumin every single day.
Wow.
Albumin is a key protein in the blood,
Right.
and the lymphatic system is constantly cycling it back into circulation.
So it's a really busy system.
It is. It's working nonstop.
Okay, so now that we have a good understanding of how the lymphatic system works, let's talk about how we actually classify lymphedema.
Okay.
You mentioned earlier that it's a progressive condition. So how do we know what stage someone is at?
So we use a staging system developed by the International Society of Lymphology,
Okay.
and it's a 4-stage system.
All right, so stage 0.
Yeah, stage 0 is also called the latent or subclinical stage.
Okay.
And this is where the lymphatic transport is starting to become impaired.
Okay.
But you don't actually see any visible swelling yet.
So it's like the early stages.
Yeah, it's like the silent stage.
Where things are starting to go wrong, but there are no outward signs.
Is that?
Interesting.
But even though there's no swelling, There's still an accumulation of fluid and protein happening at the microscopic level.
So the damage is already beginning.
That's right.
Okay, and then what about stage 1?
So in stage 1, you start to see that early accumulation of fluid becoming visible.
Okay.
So there's noticeable swelling.
Right.
And typically the swelling will go down if you elevate the limb.
Okay.
You might also see pitting at this stage,
Right.
where you press on the skin and it leaves a little indentation.
And why does elevation help reduce the swelling at this stage?
So at this point, the tissues aren't too fibrotic yet.
Okay.
So the lymphatic system still has some ability to drain the excess fluid.
Okay.
When you elevate the limb, you're basically helping gravity to work in your favor.
So you're giving the lymphatic system a little boost.
Exactly.
Okay, and then what happens in stage 2?
Stage 2 is where things start to get a bit more serious.
Okay.
This is when the tissue fibrosis starts to develop.
So the tissues are becoming more stiff and less elastic.
Right? And because of that, the swelling might not pit anymore.
Okay.
And importantly, just elevating the limb won't be enough to get rid of the swelling.
I see.
The lymphatic system is really struggling at this point.
And why does the fibrosis develop?
So when you have this chronic buildup of protein in the tissues,
Right.
it triggers an inflammatory response.
Oh, okay.
And that leads to the production of collagen.
I see.
Collagen is what makes the tissue stiff and fibrotic.
So it's like a scar tissue forming.
Yeah, you think of it that way. And finally, we have stage 3.
Stage 3 is the most severe stage, and it's also called lymphostatic elephantiasis.
Okay.
At this stage, there's no pitting.
Okay.
The limb is permanently enlarged.
Wow.
And you start to see these really dramatic changes in the skin.
Like what kinds of changes?
You can see thickening of the skin acanthosis,
Okay.
fatty deposits, warty growths.
Oh, wow.
It can be quite disfiguring.
And what's happening at the cellular level to cause these changes? It's basically the long-term consequences of that lymphatic obstruction and the severe fibrosis.
Okay.
The tissues are chronically inflamed,
Right.
and the impaired lymph flow also makes the area more susceptible to infections.
Right, because the immune system isn't working as well in those tissues.
Exactly.
So it's like a vicious cycle.
It is.
Okay, so now let's move on to talking about the different types of lymphedema.
Good.
We've talked about the stages.
Yeah.
But how do we actually classify lymphedema in terms of its cause?
So the main distinction is between primary and secondary lymphedema.
All right, and what's the difference?
Primary lymphedema is basically a problem with the lymphatic system itself.
Oh, okay.
It's like the system is faulty from the start,
I see.
whereas secondary lymphedema is caused by damage to a previously normal lymphatic system.
So something happens to disrupt the system.
Exactly.
Okay, let's start with primary lymphedema. What are the different types?
So within primary lymphedema, we have congenital lymphedema,
Okay.
which is also known as Milroy's disease.
Okay.
This one's pretty rare,
Okay.
and it's present at birth or develops within the first 2 years of life.
Wow, so they're born with this condition.
Yeah.
And what are the hallmarks of Milroy's disease?
So it typically affects the lower limbs,
Okay.
and it's often bilateral, meaning both legs are affected.
Okay.
And we see a higher incidence in girls.
Interesting.
And there's a genetic component to it.
Oh, okay.
There's a gene called VEGFR3,
Okay.
which plays a role in lymphatic development.
Okay.
And mutations in this gene are associated with Milroy's disease.
So it's like they're missing a key ingredient for building a proper lymphatic system.
Yeah, exactly.
And are there any other associated conditions with Milroy's disease?
Yeah, and sometimes you can see intestinal lymphangiectasias,
Okay.
which are basically dilated lymphatic vessels in the intestines.
I see.
And that can lead to problems with absorbing nutrients.
Oh, wow.
And there's also a potential association with cholestasis.
And what is that?
Cholestasis is basically a blockage of bile flow from the liver. So you can see how all these systems can be interconnected.
Right. It's not just isolated to the limbs.
Exactly.
Okay, so that's Milroy's disease.
Yeah.
And then what about the other type of primary lymphedema?
So the most common type of primary lymphedema is familial lymphedema precox,
Okay.
also known as Mudge's disease.
All right. And what characterizes Mudge's disease?
So Mudge's disease usually presents a little later,
Okay.
typically around puberty.
So adolescent.
Yeah.
Okay.
And again, it's more common in females.
Okay.
And it's usually unilateral, meaning it affects just one limb,
Okay.
most often the foot and calf.
And is it also genetic?
It's also autosomal dominant,
Okay.
so there's a strong family history.
And are there any other conditions associated with Mudge's disease?
Yeah, there can be associations with things like vertebral malformations,
Okay.
cerebrovascular malformation,
Right.
hearing loss, even a condition called dystachiasis.
And what is dystachiasis?
It's where you have a double row of eyelashes.
Oh, wow, that's interesting.
So you can see there can be a wide range of presentations.
Right, it's not always just the lymphedema.
Exactly.
And then the last type of primary lymphedema is lymphedema tarda.
Yes. Lymphedema tarda is the rarest form of primary lymphedema.
Okay.
And it doesn't show up until later in life,
Okay.
typically after the age of 35.
And what distinguishes lymphedema tarda from the other types?
So in lymphedema tarda, the lymphatic vessels often look quite abnormal.
Okay.
They can be tortuous and hyperplastic,
Okay.
meaning they're kind of twisted and overgrown.
I see.
But the problem is that the valves in those vessels are incompetent.
So they're not working properly.
Exactly. They're leaky.
So the lymph fluid can't flow in the right direction.
Right. It kind of backs up.
Okay, so that's primary lymphedema.
Yeah.
Now let's talk about secondary lymphedema.
Okay.
This is the type that develops because of damage to a previously normal lymphatic system.
Right.
So what are some of the most common culprits here?
Well, worldwide, the most common cause of secondary lymphedema is filariasis.
And what is filariasis?
Filariasis is a parasitic infection
Okay.
that's spread by mosquitoes.
Oh, wow.
And the parasites can actually lodge themselves in the lymphatic vessels
I see.
and cause blockages.
So it's like a physical obstruction.
Exactly.
And is filariasis common in the U.S.?
Not really. It's more common in tropical and subtropical regions.
Okay.
But in developed countries like the U.S., the most common cause of secondary lymphedema is actually cancer treatment.
Oh, wow. Okay.
Things like surgery and radiation therapy
Okay.
can damage the lymphatic vessels.
So, for example, if someone has breast cancer and they have their lymph nodes removed,
Exactly. That's a classic example.
that can lead to lymphedema in the arm.
Right. The axillary lymph nodes are often removed as part of breast cancer treatment.
Right.
And that can disrupt the lymphatic drainage in the arm.
And radiation therapy can also damage the lymphatic vessels.
Absolutely. Radiation can cause scarring and fibrosis,
Right.
which can impede lymph flow.
Okay. So cancer treatment is a major cause of secondary lymphedema. And are there any other causes besides cancer treatment?
Yeah, there are a few other things that can contribute.
Okay, like what?
Sometimes trauma or infections can damage the lymphatic vessels.
Nope.
And certain surgical procedures like
Okay.
liposuction or brachioplasty, if they're not done carefully,
Right.
can also disrupt the lymphatic system.
So any kind of insult to the lymphatic system can potentially lead to lymphedema.
That's right.
Okay, so let's switch gears a bit and talk about what happens if lymphedema is left untreated.
Okay.
What's the natural course of this condition?
So one thing to keep in mind is that there can often be a significant delay between the initial lymphatic insult
Right.
and the onset of symptoms.
So someone might have damage to their lymphatic system but not realize it for a while?
Exactly.
Okay.
And then over time, they might start to notice some mild swelling.
Right.
Comes and goes.
Okay.
But if it's left untreated, that swelling can become more persistent.
Okay.
And the tissues can start to undergo those fibrotic changes we talked about.
So it's important to catch it early.
Absolutely. Early intervention is key.
And what are some of the potential complications that can arise if lymphedema is not managed properly?
So one of the biggest concerns is infection.
Okay.
When the lymphatic system isn't working properly,
Right.
it compromises the immune defenses in that area.
I see.
So people with lymphedema are more prone to developing things like cellulitis
Okay.
or erysipelas.
And those are bacterial skin infections.
Right.
And they can be quite serious.
They can be, especially in someone with a compromised lymphatic system.
Right.
Another potential complication is lymphangitis,
Okay.
which is an inflammation of the lymphatic vessels themselves.
And what causes lymphangitis?
It's usually caused by a bacterial infection,
Okay.
and it can present with red streaks on the skin,
Oh, wow.
pain, swelling, and fever.
So it's like a spreading infection.
Yeah, it can be.
And then there's the risk of lymphangiosarcoma.
Yes, lymphangiosarcoma is a rare but very serious complication. It's a type of cancer that can develop in the lymphatic vessels,
Wow.
and it's most often seen in people who have had long-standing lymphedema.
So it's like a long-term consequence of the chronic inflammation.
Exactly.
And is there a specific type of lymphangiosarcoma that we worry about in breast cancer patients?
Yes, there's a type called Stewart-Treves syndrome,
Okay.
which is lymphangiosarcoma that develops after a mastectomy.
So that's something we definitely want to be on the lookout for.
Absolutely.
And beyond the physical complications, there's also the psychosocial impact of lymphedema.
Yeah, that's a really important consideration.
Right.
Lymphedema can be very disfiguring.
Right, especially in the later stages.
Exactly, and that can have a huge impact on people's self-esteem, their body image, their quality of life.
So it's not just a physical condition.
No, it's very much a holistic condition.
And we should also mention that in obese patients with severe lymphedema, you can sometimes see this massive localized edema.
Yes, that's right.
And it can sometimes be mistaken for a tumor.
Exactly. It's sometimes called pseudosarcoma.
Pseudosarcoma.
Yeah, because it can look like a sarcoma on imaging.
So it's important to be aware of that.
Absolutely.
Okay, so let's talk about how we actually diagnose lymphedema.
Okay.
What are the key things we're looking for in the history and physical exam?
So in the history, obviously we want to know if there's any history of trauma,
Okay.
surgery, radiation.
Right, those are the risk factors.
Exactly.
Okay.
And then in the physical exam, the first thing you'll notice is the swelling.
Right.
And the swelling of lymphedema has a very characteristic feel to it.
Okay.
It's often described as doughy or firm,
Okay.
and it's usually non-tender.
Okay.
So it's not like the swelling you might see with an infection.
Which would be red and painful.
Right, exactly.
Okay. And then there's Stemmer sign.
Yes, Stemmer sign is a classic sign of lymphedema.
Okay, remind me what that is.
So you basically try to pinch a fold of skin
Okay.
at the base of the second toe or finger.
Okay.
And if you can't pinch a fold of skin, that's considered a positive Stemmer sign.
And that's because the skin is so thickened.
Exactly.
Okay, and then what about peau d'orange?
Peau d'orange is another characteristic sign.
Okay, and what does that look like?
So it's called peau d'orange because the skin looks like the peel of an orange.
Okay,
It has this kind of dimpled appearance,
I see.
and that's due to the fibrosis in the dermis.
So the skin is getting thicker and less elastic.
Right.
Okay, and then we can also look for blunting of the digits.
Yeah, that's another common finding.
Okay.
The normal contours of the fingers or toes can become flattened,
Okay.
and the nails might even become thickened.
So all of these signs are pointing to chronic lymphatic obstruction.
Exactly.
Okay. And what about objective measurements? Can we actually measure the swelling?
Yes, absolutely. So we use circumferential measurements to compare the size of the affected limb to the unaffected limb.
I see. So we can actually track the progression of the swelling over time.
Exactly, and that can help us to monitor the effectiveness of treatment.
Okay, so that's the physical exam.
Yeah.
What about imaging studies? Are there any specific imaging tests that are helpful for diagnosing lymphedema?
Yes, so the gold standard for diagnosing lymphedema is lymphoscintigraphy.
Okay. And what does that involve?
So basically it involves injecting a radioactive tracer
Okay.
into the lymphatic vessels of the foot or hand,
Okay.
and then taking images to see how the tracer travels through the lymphatic system.
I see. So we can actually visualize the lymph flow?
Exactly.
Okay. And what does a lymphoscintigram show in someone with lymphedema?
So you'll typically see a delayed or absent flow of the tracer,
Okay.
and you might see a backflow of the tracer.
So it's going in the wrong direction.
Right.
And are there any other imaging tests that are sometimes used?
Yeah, sometimes we'll use MRI or CT,
Okay.
but they're not as sensitive as lymphoscintigraphy.
Okay.
But in chronic lymphedema,
Right.
they can sometimes show a characteristic honeycombing pattern in the subcutaneous tissues.
Okay. So that's something to look out for. Okay. So now let's talk about treatment.
Okay.
What are the main treatment options for lymphedema?
So the first line of treatment for lymphedema is always conservative management.
Okay. And what does that entail?
The mainstay of conservative management is complete decongestive therapy.
Complete decongestive therapy.
Yes, or CDT for short.
Okay. And what does CDT involve?
So CDT is a comprehensive approach
Okay.
that involves several different components.
All right. Like what?
One of the key components is manual lymph drainage.
Manual lymph drainage.
Yeah, which is a specialized type of massage
Okay.
that helps to stimulate the flow of lymph fluid.
So it's like manually moving the fluid along.
Exactly.
Okay.
Another important component is compression therapy.
Okay.
So this involves wearing compression bandages or garments
Okay.
to help reduce the swelling.
So like squeezing the fluid out.
Yeah, and also supporting the lymphatic vessels.
I see.
And then we also incorporate exercise,
Yep.
specific exercises that are designed to help pump the lymph fluid.
Okay.
And meticulous skin care is also crucial
Okay.
because people with lymphedema are more prone to skin infections.
Right. We talked about that earlier.
Exactly.
Okay. So that's CDT.
Yeah.
And is CDT typically done by a specific type of therapist?
Yes, it's usually done by a certified lymphedema therapist
Right.
who has specialized training in this area.
So it's not something that just any massage therapist can do.
Right. It's a very specific skill set.
And how effective is CDT?
CDT can be very effective,
Okay.
especially in the earlier stages of lymphedema.
Okay.
It can significantly reduce the swelling
Right.
and improve symptoms.
And does CDT have different phases?
Yes, it does.
Yeah.
So initially there's a reductive phase
Yeah.
where the focus is on reducing the swelling as much as possible.
Okay.
And then once the swelling is under control,
Right.
the patient transitions to a maintenance phase.
Okay. And what does the maintenance phase involve?
So the maintenance phase involves continuing with the compression therapy, the exercise, and the skin care. And the patient is also taught how to do self-manual lymph drainage.
So they can manage their condition on a daily basis.
Exactly.
Okay, so that's conservative management.
Yeah.
What about surgical treatment?
So surgical treatment is usually reserved for cases where conservative management hasn't been successful, or for very severe cases.
Right.
And there are a few different surgical approaches.
Okay, like what?
One category is resection procedures.
Resection procedures.
Yeah, so these involve actually removing some of the excess tissue.
Wow, okay.
One of the earliest procedures was the Charles procedure,
Okay.
which was quite radical.
Right.
It involved removing a lot of tissue
Right.
and then covering the area with a skin graft.
I see.
But nowadays, we tend to use more conservative approaches,
Okay.
like the modified Charles procedure or the Miller procedure.
And what do those procedures involve?
So they involve making a longitudinal incision,
Okay.
removing some of the subcutaneous tissue,
Right.
and then closing the wound in layers.
Okay, so it's like a debulking procedure.
Exactly.
And then there are the microsurgical approaches?
Yes. Microsurgical techniques have become increasingly popular in recent years.
Okay.
And one of the most promising techniques is lymph node transfer.
Lymph node transfer.
Yeah. So this involves taking healthy lymph nodes from another part of the body and transplanting them to the affected area.
Wow. So you're basically giving the area a new set of lymph nodes.
Exactly.
And how does that help?
So it's thought to work in a few different ways.
Okay.
One is that it can help to release scar tissue,
Okay.
which can improve lymph flow.
Right.
Another is that it introduces new vascularized tissue, which can promote the growth of new lymphatic vessels.
I see.
And lymph nodes also produce a substance called VEGFC, which is a growth factor that stimulates lymphatic growth.
So it's like a fertilizer for lymphatic vessels?
Yeah, you can think of it that way.
And are there any other microsurgical techniques?
Yeah, another option is lymphatic vessel transplantation. So this involves using healthy lymphatic vessels as grafts to bypass areas of obstruction.
So you're creating a new pathway for the lymph fluid.
Exactly.
And then there's lymphatic venular bypass.
Yes, lymphatic venular bypass is a minimally invasive procedure where you basically connect lymphatic vessel directly to a nearby vein.
Oh, wow.
So you're creating a shunt
I see.
to allow the lymph fluid to drain into the venous system.
So it's like bypassing the blockage?
Exactly.
And what about liposuction?
So liposuction can be used in some cases of lymphedema. But it's important to understand that it's not a cure.
Right.
It's basically a way to reduce the volume of the limb by removing excess fat.
So it's more of a cosmetic procedure?
In a way, yes. But it can be helpful for improving mobility and reducing the risk of infections.
And are there any special considerations for liposuction in lymphedema patients?
Yes. It's absolutely crucial that patients who have liposuction for lymphedema wear compression garments after the procedure.
And why is that so important?
Because liposuction removes fat.
Right.
But it doesn't address the underlying lymphatic problem.
I see.
So if they don't wear compression,
Right.
the fluid can just build back up again.
So it's like a temporary fix.
Yeah, unless they're diligent about compression.
So it's not a standalone treatment.
No, it has to be part of a comprehensive management plan.
So we've covered a lot of ground here.
We have.
Let's try to summarize the key takeaways for our listeners. So lymphedema is a chronic condition that results from impaired lymphatic drainage.
Right.
And this leads to a buildup of protein-rich fluid in the tissues.
Exactly.
And we classify lymphedema based on its cause.
Yeah, primary versus secondary.
Right. And we also stage it based on the severity of the symptoms.
Exactly. Stage 0 through stage 3.
And it's important to understand the different types of primary lymphedema.
Yeah, Milroy's disease, Meji's disease, and lymphedema tarda.
Right. And the various causes of secondary lymphedema.
Things like filariasis, cancer, treatment, trauma, surgery.
And we also talked about the potential complications of lymphedema.
Infectious lymphangiosarcoma.
Right.
Psychosocial impact.
And the importance of early diagnosis and treatment.
Absolutely.
Conservative management with complete decongestive therapy is the first line of treatment.
Yeah.
And surgical options are reserved for cases where conservative management fails or for very severe cases.
Right.
So as a surgical resident, preparing for your board exams, like the FRCS,
Yeah,
you really need to have a solid grasp of all of this information.
absolutely.
You need to understand how the lymphatic system works,
Yeah.
the different types of lymphedema, the
Mhm.
causes, the stages, the complications,
The treatments,
like treatments.
both conservative and surgical.
Exactly, because this knowledge is essential for providing good patient care and for
Absolutely.
passing those exams.
No question.
So hopefully this deep dive has given you a good foundation,
Yeah, I think so.
and we wish you all the best in your studies.
Good luck.
All right, that's it for today.
Thanks.
See you next time.